Good evening, everyone. My name is Veronica Rodriguez, and I'm the Outreach Coordinator at the Penn Medicine's Bassler Center for BRCA. On behalf of the Bassler Center, I would like to welcome you to tonight's panel discussion, Family Reunions, Family Health History Conversations, in recognition of Black Family Cancer Awareness Week. The opinions and experiences shared tonight are the panelists' own and do not represent those of the Bassler Center or Penn Medicine. You should consult with your healthcare team should you have any questions about the specifics of your health and medical plan. Thank you to our panelists for joining us this evening for this important discussion. Before I introduce tonight's moderator, our theme is focused on having family health history conversations during family reunions. As the family reunion season is quickly approaching, we ask our panelists to wear t-shirts that represent their families, which we'll hear more about. And now I would like to introduce our moderator, Ashley Dedmon, is a native Houstonian who holds a Bachelor of Science degree in Community Health from the Prairie View A&M University. She also earned a Master of Public Health from Florida A&M University. She is a certified health education specialist and holds a Lean Six Sigma Green Belt. Ashley has a diverse and multi-sectoral career background, ranging from nonprofit, education, healthcare, policy, and government. Ashley is a BRCA2 previvor and was a teen caregiver of two parents with cancer. She actively volunteers focusing on various health equity issues with Bassler's Young Leadership Council, the Tiger Lily Foundation, as a peer navigator and angel surviving cancer. And with that, I'd like to turn it over to Ashley.
Thank you, Veronica, and thank you to the Bassler Center and the Black and BRCA Initiative for the opportunity to moderate this very important event. I'd like to get started this evening by introducing our panelists and thanking them generously for offering their time to this event. First, we have Jessica Savage Jones. She is a public health nurse who has been working in nursing for 13 years. In her current role, she is a clinical researcher at the University of Pennsylvania. Jessica works with individuals who are at various stages of their cancer diagnosis, for those who are newly diagnosed to those with metastatic breast cancer. While working in this capacity, Jessica has developed a passion for patient advocacy and addressing awareness and diversity in clinical trials. Welcome, Jessica. Next, we have Erika Stallings. Erika is an attorney based in New York City. She currently works as an assistant general counsel at Facebook. She serves as co-chair of the Bassler BRCA Young Leadership Council. On July 2014, she learned that she carried a BRCA2 mutation and underwent a preventative mastectomy in December 2014 to lower her risk of developing breast cancer. She is passionate about the mission of the Bassler Center and strives to educate other women about hereditary cancer. Welcome, Erika. Next, we have Lyndsay Levingston. She is an experienced multimedia maven and communications professional. Lyndsay was diagnosed with stage 2B triple negative breast cancer in July of 2019 and discovered that she is a BRCA1 gene mutation carrier. She celebrates her cancer-free status as the founder of Survive Her, a breast cancer awareness and wellness nonprofit whose mission is to inform, inspire, and empower women. Welcome, Lyndsay. Finally, we have Micah Anders. She is a professional genealogist and artistic placemaker. Micah's family cancer journey began with her father's diagnosis, followed by multiple family members. In 2013, Micah learned that she carried the BRCA1 mutation and started to fully understand the impact of knowing both your family history as well as your family medical history. Now she is a 6-year survivor of triple negative breast cancer. Micah uses her genealogy and DNA skills to help others learn about their family medical history for both personal and health purposes. Welcome, Micah. And thank you all for agreeing to share your knowledge and experience with us this evening. Before we kick off the panel, we're going to go around the room really quickly and share a little bit about the shirts that we're wearing. We're all wearing shirts that are important to us and have some sort of significance. And so, Lyndsay, if you can kick us off to share with us what shirt you're wearing and what does it mean?
So I am the proud founder of Survive Her, a breast cancer awareness nonprofit that I started as really a result of my breast cancer journey. I felt a calling over my life to inform, inspire, and empower women about genetic testing, the importance of family history. And so I thought that this shirt would be appropriate to wear as it relates to tonight's dialogue.
Thank you. Next, we have Jessica. Jessica, share with us what shirt you're wearing and the significance.
Hi, everyone. I'm wearing a t-shirt from my family reunion. These are Wilson and Adeline, and these are the starters of my mom's side of the family, the Stevens side.
Thank you. Next, we have Erika and then Micah.
Yeah, this is I didn't have any family reunion shirts with me, but this shirt is a gift from my fiance. It's like a reference to one of his favorite movies. So we both have the same t-shirt.
I love it. Thank you for sharing. And Micah.
The shirt I have on, it says Midwest is best. It has all of the Midwest, probably a little bit extra sitting on there. I am a many generation Midwesterner, and so that is where my family roots come from.
I love it. I love it all. And I am actually wearing my husband's family reunion t-shirt from our family reunion in 2019 prior to COVID. So that was the last time we were all able to get together. So looking for many more to come.
Ashley, can we get a peek of your t-shirt?
Absolutely.
All right, representing the Dedmans.
Let's get started. To provide some general background and to really lay the groundwork for those who will be listening to this event, Jessica, could you please give us a brief overview of what is BRCA, why you should get tested, how do you get tested for it, and what does the testing process look like? And then finally, when do people usually receive their results?
Of course, Ashley. So BRCA stands for the breast cancer gene, and there are two of them. It's BRCA1 and BRCA2. And these are both genes that produce proteins that help repair damaged DNA. Everyone has two copies of these genes. One copy is inherited from each parent. In order to survive, all cells, even cancer cells, must be able to repair their genetic material or DNA when it is damaged. A mutation is an alteration or change in a gene either inherited from a parent or acquired over time that prevents the gene from working properly. Faulty genes that carry a mutation have been linked to increased risk of hereditary breast cancer and ovarian cancer, and also other cancers such as prostate cancer. People who have inherited a harmful variant of the BRCA1 and BRCA2 also tend to develop cancer at younger ages than people who do not have those variants. And so about 5 to 10% of breast cancers are thought to be hereditary, and they are caused by the genetic mutations that I mentioned previously. And so when we think about who should get testing for different genetic mutations, we think of individuals who have had blood relatives who were diagnosed with breast cancer under the age of 50, those who have a family history of both breast cancer and ovarian cancers, relatives with triple negative breast cancer, African Americans diagnosed at age 35 or younger, and anybody who has a known genetic mutation in family that has been linked to breast cancer. Those are the common recommendations. Those are just the ones that I really wanted to highlight, but there are other recommendations as well. And so when you are thinking about getting tested for these genetic mutations, you want to first talk to your healthcare provider and plan to meet with a genetic counselor before the actual test. And this conversation, it'll help you understand what to expect. The counselor will tell you about the pros and cons of the test, what the results will mean, and what are your options after you receive the results. In addition, there will also be a conversation about your family history. And this will be a really detailed one to find out current issues that family members have, conditions that may have caused the death of a family member. And it's just really trying to get a picture of really a better understanding of your risk for cancer. And so depending on the type of test, you might be asked to submit a blood sample or even a saliva sample for DNA. And these results, depending on the type of test that you get, because there's a lot of genetic tests that can be used, but these tests may take up to 2 weeks or several weeks to come back. And so once these results have been completed, you'll have a follow-up appointment with a genetic counselor, and they will review in detail what the results mean, how they may impact your risk for cancer, and also if you need to disclose this information to other family members. And so that's basically a BRCA 101, and also, just some information about genetic counseling.
Thank you, Jessica, for that information and for that explanation. That helps to really lay the groundwork for today's conversation. And also, it further helps to provide a great background on the clinical topics. And now we'll shift and hear from our other panelists. For each of you, please share how you found out you were a BRCA gene mutation carrier, and what did that mean for you and your family? Let's get started with Lyndsay. Lyndsay, tell us how you found out about your gene mutation.
Sure. So in July 2019, I was diagnosed with triple negative stage 2B breast cancer. And my breast surgeon outlined a very comprehensive plan of treatment that would include neoadjuvant chemotherapy to shrink the mass that I felt in my right breast, followed by a lumpectomy and radiation. Well, when I started chemotherapy, between rounds 4 and 5, I received a phone call from a female cousin on the paternal side of my family, and she alerted me that breast cancer was dominant on the paternal side of our family, and that at least a dozen women had been diagnosed with breast cancer. She was diagnosed at the age of 29, and she was a BRCA1 gene mutation carrier. So she empowered me to share that information with my doctor. I shared that information with my doctor. My doctor ordered a medical genetic test via Invitae, and the results revealed that I was positive for a BRCA1 gene mutation. I remember after receiving those test results, we then sat down and mapped out a family tree, and it was confirmed that the gene mutation status was came from my dad's side of the family. Well, I will say this, when I was diagnosed, I had no idea that I had a family history of breast cancer, definitely not on my mother's side. And I was just clueless to what was happening on my dad's side of the family, because it wasn't part of the dialogue or conversation. So Ashley, to answer the second part of your question, what did that mean for my family? Well, it meant that we needed to raise awareness, that I needed to continue that actually jumpstart the conversation that had been silent for so many years and across so many generations. I also empowered my female cousins who are around my age to get tested, and they got tested. They do not carry the gene mutation. So there was really a domino effect as a result of learning of my status. My goal, as I mentioned earlier, through Survive Her, is to inform, inspire, and empower. And part of my message to audiences, both female and male, is to seek genetic testing, know your family history.
Thank you, Lyndsay. You said a few things that really stuck out. You said you had that silence, and a lot of times that silence can be generational. And so we have to break that silence. So glad that you had that conversation with you and your family members. Erika, can you tell us how you found out about being a BRCA mutation carrier and what that meant for you and your family?
Yeah. So when I do panels like this, I always tell people that my BRCA story starts with my mom. My mom is a 2-time breast cancer survivor. She's currently been in remission for almost 15 years from the second diagnosis she had. But she got breast cancer for the first time in 1993, which was a couple of years before scientists made a connection, realized that there was a hereditary cause of breast cancer. And she was only 28 years old at the time. She underwent chemotherapy and radiation and lumpectomy, and then she was in remission until my senior year of college. I went to the University of North Carolina at Chapel Hill, which has a really amazing cancer center. And so when she was diagnosed the second time, she was diagnosed with triple negative breast cancer in a different breast. And that's when her oncologist suggested to her that she undergo genetic testing because she had all of these red flags, the early onset of breast cancer the first time, even having breast cancer again in her early 40s, the triple negative breast cancer. And so I have known since 2007 that there was a possibility that I could carry a BRCA2 mutation, which is what my mom has. And then, as you sort of touched on in the intro, I underwent genetic testing in 2014, learned that I had inherited that mutation from my mom. And then I underwent a preventative mastectomy at the end of December 2014. In terms of what it has meant for my family, I'm an only child. And I will say that I think, like in a lot of Black families, sometimes people sometimes want to like bury their head in the sand. So even though my mom has 3 siblings, it's not like something that they're like willing to consider. And so the way that I think about it is like you kind of just always keep trying, like, right? Like we know that like knowledge is power. We know that knowing family history is important. So like you try once, and then if people aren't responsive, then you just like try again. So that's sort of like where my family story is right now.
Thank you, Erika, for sharing, and thank you for just advocating and continuing to make young women aware of the importance of this. Next, we have Micah. Micah, will you share with us how you found out about your BRCA mutation and what that meant for your family?
Yeah, so similar to Erika, I was not the first in my family that I knew about. So my dad actually was diagnosed with prostate cancer when I was younger. He was probably in his 40s at the time. And they didn't get clean margins. Of course, I had no clue what any of that meant then. I was like, I don't know what that means, but something about it might come back. And then it did unfortunately come back while I was in graduate school. And I was in graduate school and I was pregnant and then I had a baby. So that was kind of what I was doing while he was unfortunately going through his treatment in another state. And it did end up taking his life, but I was able to go home and be with him while he was on hospice. So that was sort of my first round. And I didn't fully understand everything that was going on. And he's also a very secretive person, very much like I kind of keep things to myself and I don't want my daughters in this case to know, prostate issues. So that was always kind of odd. And then I had a sister get diagnosed with cancer around 40. And then I had a second sister get diagnosed with breast cancer around 40. I had a first cousin, my dad's brother's daughter, get diagnosed with breast cancer. And when my second sister was diagnosed, she was given genetic testing and found out that she carried the BRCA gene, BRCA1. And through that process, she called us all and said, you probably should get tested. It's starting to be pretty clear that it's coming from our dad. And a lot of people didn't even think about it because it was prostate. But there is a clear tie between prostate and BRCA. But that's not really education that we're given. And so everyone says, oh, it's your mom's side. Oh, it's breast cancer or ovarian. And for us, it was not. And so I was fortunate to get a lot of my preventative care at the Mayo. So I chose to get every 6-month testing done for a few years instead of doing a preventative surgery right away. I was in my early 30s and I had a very small child when I found out I was a carrier. And that was actually, I guess I almost forgot really quickly, that was actually kind of an adventure because since I hadn't been diagnosed yet, when I went to genetic counseling and I drew up my little family chart, which was fun because I do genealogy, they said insurance wouldn't cover it because I didn't have cancer yet. And it's kind of like, well, isn't that the whole point? I've shown you my chart. It's on my dad's side. And so something about that made insurance not believe it. And so it was just a big mess. But I was able to get insurance to cover and tell me I had the BRCA1. But then I did end up getting triple negative breast cancer, which I found myself between my 2 6-month treatments because I have dense breasts, as they like to tell all of us. And so they actually didn't quite find it. And once I went through treatment, I really had a totally different understanding of what had gone on with my dad and all the things he didn't tell us. And he would sit at chemo alone and things like that just I got, but I didn't fully understand until afterwards. And so now, since then, I've had another sister and another first cousin also have breast cancer or have the gene. So it's just something we just keep pushing out into our family. Get tested, get tested, get tested. Unfortunately, my two brothers have not chosen to get tested, which is a bit frustrating because it came from our dad. And so at this point, it's just information, advocacy, helping others as well as my own family just really learn their family history, trace both sides, and help them understand where it came from. And I also do research to help people look at those death certificates and family members who died early and try and make some of those connections for families who don't share the information verbally.
Thank you, Micah, for sharing. You said several things. One that really stuck out to me was that this gene is on your father's side. And I'm going to have Jessica talk a little bit about that before we go into the last question. But I want to thank you all for your transparency and authenticity with sharing your journey. Jessica, you've heard what these amazing women have just said, and I know Micah just hit on this gene being on her father's side. And while I'm not a genetic counselor and I'm not going to speak outside the scope of my experience, can you share a little bit more about when we say family history, what that means, meaning mother and father or maternal and paternal? Can you share more with us about that and a few insights from your experience as a nurse caring for patients from families with hereditary cancers?
Yes, absolutely. So I think, just in listening to everyone's story, it's so important that we know not only your mother's side, but also your father's side. And I think sometimes that communication about, different conditions, cancers, it's not said because sometimes there's this misconception if I tell someone what's going on, it's going to be a burden on my family members. And I don't want that to happen. But as you can see, it's just so critical to have those communications with family members so you can truly understand, okay, these are my risk factors. I may, be more likely to have cancer or certain health conditions. So a lot of the people that I come in contact with, they don't know their whole history. So it's kind of hard to sometimes put those pieces together because those conversations aren't had. So it's very, very important. I think you all have stressed it that, those conversations need to be had. Even like when I think about my patient experience, when I see them in clinic, I think there's a small amount who are actually offered genetic testing up front. It's typically, women who are diagnosed with triple negative and are younger that are offered upfront the genetic testing. But even when there is a family history of breast cancer, people aren't being asked, do you want genetic testing? I've had several members in my family who have had breast cancer, and I asked them, I said, have you ever had the opportunity to get genetic testing? They were like, no, what's that? Why haven't we, had that opportunity? So I feel like, we are really missing out on really understanding genetic testing and getting people tested so that way they know their risk and they can make certain lifestyle changes, to help decrease or prevent their risk of cancer. So I think we really, as a healthcare provider, really need to empower and encourage people to ask about genetic testing if their healthcare providers aren't asking, if they want genetic testing.
Thank you for that. And that really takes me to the next question, and I'm going to open it up to all the panelists. How have you approached this information with relatives who might be resistant to genetic counseling and testing? What have been some of the ways y'all talked to your family members and have encouraged them and empowered them to talk about genetic counseling and testing?
Ashley, you mentioned something earlier about breaking the cycle. So for me, being the 14th female Levingston to have been diagnosed with breast cancer, that already in itself is an alarm. And so I am sharing that with not only the Livingstons, but also the Davises, my mother's side of the family, that at some point we have to stop this silence, break the silence, and decrease our statistic. Like, we don't need a 15th, a 16th, a 17th Levingston to be diagnosed if she knows early enough, early in life. One thing I didn't share is that learning the status of that, the BRCA1 gene mutation carrier status, that completely changed the course of my treatment plan. So my doctor recommended, instead of after chemo 15 rounds, lumpectomy radiation, it was 15 rounds, bilateral mastectomy, breast reconstruction, removal of ovaries and fallopian tubes. So I've been like picked apart, think about Frankenstein. And I share that story with my family. Like, do you want to go through this, or do you want to stop it where, like, let's stop it with Lyndsay. And had I known earlier in life, I could have taken the preventative measures. I could have had a prophylactic mastectomy or prophylactic hysterectomy, pre-childbearing years or post-childbearing years. So I really just advocate, push, and do the best that I can to encourage family members to get tested. Just using my own personal story as a testimony.
Lyndsay, I love what you said. It reminds me of my family history, having 3 women impacted by breast cancer and not wanting it to be a 4th or a 5th or a 6th. And so that definitely hit home with me. Micah or Erika, do you want to share?
I can. I think one thing I do is sort of the opposite side of what you do, Lyndsay, which is I help. When I talk with people, I talk about what happens through the process of all of the surgeries, right? What is it like to have to go through it? Because I think some people in my family and that I've spoken with are so scared. They want I don't want to know because it's scary. And so talking to them about, this is what I went through. This is what I'm dealing with now 6 years later. This is what I don't even remember because it was a huge deal at the time and it was life altering. But, I have been fortunate to have life after that and move on. And having some of those discussions has helped as well. Help take some of the fear out of if you do get it as well.
Erika?
Yeah, no, I don't, I guess unfortunately, I feel like I don't really have much to add because I feel like I haven't really had fruitful conversations with my family around this topic. Which is unfortunate, because like I think about how young my mom was and like the fact that like because I got genetic testing, like I was able to, sort of prevent something that she went through. But I think some of this is also like an access issue. A lot of my family is from like rural Eastern North Carolina, where at least the last time I checked the NSGC website, there isn't a genetic counselor within 50 miles of Goldsboro, North Carolina, right? So, so much of this is like getting people just like comfortable with the idea around like genetics and family history, right? And I think that's harder to do when, you kind of don't even have like a lot of examples around you of people who have gone through, or it's not like so maybe like integrated into like the points of care that people are normally accessing.
No, thank you for sharing. There's definitely, we have to educate, but then also there's a lot of work that will need to continue to be done to grow the workforce in genetic counseling and testing, as well as addressing the disparities in genetic testing and counseling. And as we close out, I would love to get everyone's takeaway for today, but I also am going to throw a little twist in here. Talking about families, the Black family. In addition to your takeaway, give some of our viewers ideas about how and when they can share family history. Maybe it's a family reunion, maybe it's a girls' night, a book club. I'm going to share mine really quickly. Mine is I have left my BRCA gene mutation status in my will. So as my husband and I were doing estate planning, if I were to go today, my girls would probably not remember that I carry this mutation. So I left it in my will that I carry this mutation. I left all the documentation. So as if I were to go before they were old enough, they would have that information. So I'm going to kick it to Erika. What's your takeaway, and what's a creative way that we can begin to have these conversations in social settings?
Yeah, I would say it's very like cliche, but this idea of like knowledge is power. Even if you don't necessarily feel like preventative surgery is for you, Like the fact that you can, take extra screenings, like arm yourself with that information, at your annual physical. In terms of things that I think sort of creative ways to share this information, as was mentioned in the intro, I'm aware. And I've actually had a lot of success, like having those conversations, like in Black women alternative groups or at like conferences, like aimed at, Black women. And what I've actually found is like the most effective is like actually like bringing a genetic counselor who can like just come and answer questions, because so many people don't even know what a genetic counselor is. You're right, but when they learn about it, like I think Black women and Black individuals are actually very excited to get this type of information. And so I think you sort of have to like bring the mountain. You have to bring the mountain to Muhammad. I think it's the right analogy.
That's amazing. Thank you for sharing. That's definitely amazing. We're definitely normalizing the conversation in conference settings, professional settings. I love it. Micah, what are your thoughts? What are some of your creative ideas on how to have this conversation and normalize it? And then what are some of your key takeaways?
So I think one thing that we haven't talked about that I think applies in my family and probably a lot of families, especially in the Black community, is not everybody is super connected to their families, right? We talk a lot about family reunions and this branch talks to each other, but oftentimes it's not as connected. And how do you have those conversations outside of the close part of your family? And I think sometimes it's odd things, like maybe you're actually Facebook friends with your cousins, but you don't actually talk to your cousins for whatever various reasons. And I think there's some really great ways to use social media to, share how our lives are going, or I'm getting tested, or I got tested and here's what I learned. I think it's that sharing, like we're talking about, right? Sharing your story, sharing what you went through, and even adding things like it's a family trait and things like that, just to help put that knowledge into our families that maybe we aren't as close with, or maybe this is also a great opportunity to build some of those bridges. Maybe it's a previous generation, they didn't talk, and so we don't talk, right? And so maybe we can use this unfortunate thing as a way to build some of those bridges across our family.
I love it. I love the term building bridges and using and leveraging social media to share that information. Because you're right, we don't see cousins and auntie every single day. We may see them once a year, maybe. And we know even through COVID, we didn't even really come in contact with family physically. So I definitely love that idea. Lyndsay, what about you? Do you have any creative ideas for sharing family history in social settings around family and friends? And then what are some of your key takeaways for today?
So, Ashley, you know this. I am events driven. I love to host a party. So strategically through Survivor hosts brunches, cocktail events, happy hours, at which we will have a medical professional or a panel discussion or some type of dialogue around not only breast cancer awareness, but genetic testing. And so I have an event that we're hosting for National Cancer Survivors Month locally here in Houston. And so I've already extended the invite to the female cousins on my dad's side of the family, because, they'll love to talk about anything with a beverage in their hand, right? But that's helping to normalize it, and they're more comfortable in those social settings to share their stories, to listen, to engage in dialogue and conversation. And my takeaway for this dialogue, this panel discussion, is to spread the word and continue to advocate and use your voices and your platforms, as you are already doing, to raise awareness about the importance of knowing your family history, because the sooner that we have our information and we're equipped and armed, as we always say, early detection is key, but the earlier we can receive the information, the earlier we can lay out that treatment plan, that preventative plan, and really take the reins back on our life, our health, and our wellness.
I love it. Thank you, Lyndsay, for sharing. You're right. Getting everyone together in those social settings at a party or event, sometimes that's the best way, because people love to connect. People love to come together. And so I even had a friend who had a book club and talked about genetic testing. But I think in any of these settings, it's always important, and I'm going to pitch it back to Jessica to close us out if she has any last statements. But I think it's always important to know that there are going to be some people who are not comfortable having the conversations, and it's okay. But I think if we start normalizing it, when they're ready, they will know that they can come to a Lyndsay, they can come to a Micah, they can come to an Erika, and they can come to an Ashley, and we're able to redirect them to the professionals that are able to answer their medical or clinical questions. We're able to send them to resources like the Bassler Center for BRCA, professionals like Jessica. And so it's just always important to know that we're all in different places and spaces in our journey, but to continue to have the conversation, continue to normalize it, but still being aware and respectful of where people are in their journey, but being consistent. I think that's always key. Jessica, before we close it out, any last words from your perspective, the clinical perspective?
Yeah, I just want to say too that this was just such a wonderful, conversation just to hear you all's perspective about, how you found out you had the mutation, and just kind of understanding how you spread the word to your family members. That was really interesting. And, from a clinical perspective, I think Ashley, I think you had said you have to meet people where they are. So even in a clinical setting, we may ask them, they may not be ready, but we can always consistently ask, do you want to get genetic testing? And I think that is the key, because, when you don't ask, you haven't opened up that door of opportunity for that conversation to be had. So I just think it's just really, really important just to continue to ask. And when people are ready, make sure they have the resources available. But when we don't ask, we're missing, such a wonderful opportunity to educate and to empower people to take control of their health. So those are my closing thoughts. And it's just been such a wonderful conversation just to hear everyone's story.
Thank you, Jessica. And thank you all for just your knowledge, your expertise, your experience, your transparency, and your authenticity. Thank you all. I would like to thank the Bassler Center for BRCA and the Black and BRCA Initiative